My dear student, remember this. This is your clinical class. This is your clinical class. So my question is, what the aim of this class? The aim of the class is history taking, patient examination, then history presentation. That is saline picture or your case summary. Remember this. Now, how to take a good history? How to take a good history? It is a drama. It is just drama. History is taken from patient himself or from the attendants. Remember this one. The history should be taken from the patient or from the attendants. Remember this one. First of all, you will introduce with your patient. You introduce with your patient. You give your introduction with this patient. What to say? If you are Muslim, give the Assalamu alaikum. If you are Hindu, then you tell Namaste. If you are Christian, then you get good morning or good evening like this. After greetings to the patient, then you handshake with the patient like this. I am Dr. Faruque. আমি আপনাকে একটু দেখতে চাই. I like to some examination to you. If any problem, then you tell me, okay? First of all, you have to introduce. First of all, you have to introduce with your patient. Then patient will be relaxed, okay? Then ask why you came here. What is the problem of the patient? This is the chief complaint. After chief complaint, then you elaborate the chief complaint. This is called history of present illness. Elaboration of the chief complaint and some systemic inquiry. Some systemic inquiry for the differential diagnosis. What differential diagnosis? After history of present illness, then you asking for the history of past illness. She or he is developed or he is suffering from any other disease before this time. The history of past illness. In pediatrics, then and then you go for birth history. Very much important one is birth history. Antenatal, natal, postnatal history you should take. Then feeding history. That is pedictal feeding given or not, or colostrum given or not, exclusive breastfeeding given or not. This is the feeding history. After feeding history, then development history. That is, development history start from social smile. It is a social smile developed at the age of 4 weeks. Then neck control. You see the neck control is developed at the age of 3 months. Then asking of the sitting. When the baby is sitting, at the age of 6 months is sitting. Then crawling. Then crawling is 8 to 9 months crawling. Then extending. Extending usually at 10 months or 11 months, and fully extend at the age of 1 year. Then walking at the age of 15 months. Remember, the 15-month baby can walking. Next question will be asking them up to development assessment. Then go for history of immunization history. Then socio-economic history. Then family history, then treatment history. After this, then you go for that is journal examination. Journal examination, you know there is a 22 points. You should know all the 22 points. After this, then anthropometry, infertility, the anthropometry, that is height, weight, occipital-frontal circumference, visual depth. After this, then you go systemic examination. Patient is which system? Which system patient? This system only first you examine. Suppose respiratory system, then respiratory system examination first. If the patient is nervous system, then first start with nervous system. If the patient is cardiovascular system, then start first cardiovascular examination. After systemic examination, then you making the summary, case summary. That is saline picture. Saline picture of the patient. Okay. After saline picture, then you given your provisional diagnosis. After provisional diagnosis, then you sure it is provisional diagnosis. You make some points in favor and points some against. After this, then differential diagnosis. After differential diagnosis, then you give investigation. After investigation, then you go for conformity diagnosis. After conformity diagnosis, then you give the treatment plan according to cause of the patient. Okay. After treatment, then the follow-up of the patient, Then parents counseling. After the parents counseling, up to this, you should know, everybody should remember this one. Everybody should follow me what I said today. Thank you very much for patient hearing. Thank you very much.